This section is on exploring the concept of levels of evidence or evidence taxonomies in describing types of literature and understanding why levels or hierarchies of evidence are important within evidence-based medicine. The learning objectives are to recognize the relationship between types of literature in terms of evidence, explain the differences in evidence taxonomies, and understand that the best evidence may not be at the highest literature type in the hierarchy. Evidence taxonomies, often referred to as levels or hierarchies of evidence, have been created to better understand the quality and strengths of different types of literature, particularly types of research studies. They describe a rating or classification system of the research literature and are used to encourage clinicians to find and apply the highest level of knowledge or evidence to answer their clinical questions. They assist in selecting the best research evidence or answering specific clinical questions in patient situations. Some evidence levels or hierarchies of evidence provide a visual representation of the layered or stepped transition between low levels of evidence and high levels of evidence. For instance, the evidence pyramid from Dartmouth Biomedical Libraries shows expert opinion as the base of the pyramid and meta-analysis as the top of the pyramid, noting a distinction between primary research and synthesized research. In comparison, the Duke University Medical Center Library Evidence Pyramid has animal and laboratory studies at the base of the pyramid and meta-analysis at the top. The Duke Pyramid also notes the differences between observational studies, experimental studies, and synthesized evidence. What is important within any evidence taxonomy illustrating levels or hierarchies is that there is a distinction between the types of literature and synthesis of research reflective of the strength of the research. In terms of evidence, the synthesis of research studies is considered to provide higher evidence. Evidence synthesis, like systematic reviews and meta-analysis, are often used in establishing the standard of care or considered the gold standard of practice. DeCenso, Bailey, and Haynes further reinforce the value of synthesis of studies, synopsis of synthesis, and even summaries of evidence in their 6S pyramid of pre-appraised evidence. In some taxonomies, evidence is presented as grades, like the recommendation grades outlined by the United States Preventive Services Task Force that considers the certainty of benefit of a service or a prevention method balanced against the potential harms of the same service. An A grade represents a high certainty that the net benefit of the service is substantial, whereas a D grade recommends against the service due to a moderate or high certainty that the service has no net benefit or that the harms outweigh the benefits. However, the strengths of recommendation taxonomy, also known as SORT, defines the grades A, B, and C differently. SORT recommendations focus on the consistency of the recommendation and the quality of patient-oriented evidence. That is, evidence that matters to patients, such as morbidity, mortality, symptom improvement, cost reduction, and quality of life. Recognizing the differences in what the evidence taxonomy represents is essential for understanding the significance or confidence of the evidence being reported on. A more recent taxonomy, the evidence funnel, developed by the University of Iowa Hospitals and Clinics, focuses on the evaluation and application of evidence, moving from the quality of research studies, the strength of the recommendations, and the certainty of benefit to the resulting change in practice based on the evidence. Regardless how the relationship between the research studies is described, it is important to be mindful of what each taxonomy represents and how the evidence is being characterized. Additionally, being aware that a particular clinical tool or resource may refer to more than one taxonomy or level of evidence is equally important. For example, Essential Evidence Plus, an evidence-based reference tool that includes evidence-graded recommendations, makes use of 4 different evidence grading taxonomies: the U.S. Preventive Services Task Force, SORT, Center for Evidence-Based Medicine, and GRADE. Also, from one clinical practice guideline to another, Different evidence taxonomies may be applied to the recommendations. Thus, it is essential to recognize which evidence taxonomy is being referenced in a clinical tool or resource to be able to accurately interpret the recommendations provided for clinical practice. While seeking the highest level of evidence is considered best practice, keep in mind that the best evidence for a particular patient situation may not be found at the top of the evidence taxonomy. In some cases, higher study types, like randomized controlled trials, are not possible due to ethical considerations in the research design, rarity of the condition or disease, or lack of original research studies. Therefore, a retrospective study or even a systematic review of retrospective studies may represent the best evidence available for the clinical situation. This section has explored different evidence taxonomies representing the relationship between types of literature in terms of evidence, as well as the importance of recognizing which evidence taxonomy is being referenced within a specific resource or practice guideline. Additionally, this section has highlighted that the best evidence for a particular clinical situation may not be what is considered the highest level of evidence in a hierarchy.